Treatment for those who suffer from anxiety. Okay, very well. Now I'm going to explain to you what anxiety is, because the term is so general and generalized that many people don't actually know how it manifests itself. I wanted to show you this very funny picture so as to prepare you gradually to the three main principal manifestations of anxiety. So we have three types. We have physiological manifestations, we have psychological manifestations, and finally, we have behavioral symptoms. For the first one, for the physiological manifestations, well, these occur with tachycardia, palpitations, perspiration. The person may also suffer from tremor. Instead, for psychological manifestations, we have an attitude of fear of death, or the fear of dying, or the fear of going insane, or the fear of losing one's control, or being tormented by phobias. In behavioral manifestations, the person tends to show a behavior of avoidance or running away. Sometimes they are paralyzed by this fear, or they have overreactions to perfectly harmless stimulus. So the nervous system that I've just explained to you reacts differently depending on the different stimulus. But our task with this type of treatment that I'm going to teach you is to alleviate all this tension in the nervous system so as to give relief to a person suffering from anxiety, and which you're going to work on. The zone that we're going to be working on is the ribcage zone. Why? Well, in particular, because at the sternum, which is immediately underneath, we have the solar plexus, which is a network of nerves, and these are so important that when they tense up, they alter certain organisms. For example, the correct functioning of the diaphragm, that I'll show you in a minute. And they create this sort of muscle tension that suppresses the rib cage and causes these people to feel oppressed. So people who suffer from anxiety feel this load on their chest, and often I ask them, so do you feel anxious? And they say, well, yes. And I ask them, do you feel like a load on your chest? Like when you have to breathe, you have to take a big breath to take in air, otherwise you feel like you don't have enough. Well, in fact, they confirm this. And so the work that we do on the rib cage zone, I will show you in a minute. Subsequently, we can also work on the spinal cord, and in particular, we will work on the foot in reflexology. I will show you how to do that. The entire solar plexus zone. So, let's start rubbing oil on our customer's chest. So, as you can see, we're what I call openings. Then we start from the sternum, and we will move outwards for both sides. Okay, this is the zone richest in nerves, and now I'll show you how to do this. You see, I have to work on the right side of the client, so I stand on his right side. And then I start doing the palpé roulé technique. If you notice, then I'll show you a blow-up of this. The work is being done by my right hand. My left hand is only supporting the right hand. So I started from the sternum, from the side of the sternum, and then I move outwards. You see, I start again. I'm not putting too much pressure, but it's constant. It may be a little painful, but if you pull the skin away from the underlying tissue, then the result is almost immediate. Okay, enjoy now this blow up. You see, I point my fingers with my left hand My left hand, you can see it on your right hand in your screen. And my right hand is the one that you see on the left hand side. And then you sort of dig, you see, and the other one is supporting, and you can see the roll of skin that is forming. This is what you will have to do when you'll be working with your customer. This is another nice top view. So you see I'm digging, and then careful that when you do this palpebral relate under the skin, you may also cause emotional reactions in the patient, like a cry. You see here where I'm now, if you've done the course and the video on metameric massage, this is the reflex zone of the lungs, the seat of sadness. So when you release the dermalgia and you help breathing and any other problems related to the lungs, you also cause an emotional release. It may have happened to you that in the past the person had an outburst. Now, this is another image. Again, I moved on the left side of the customer. Now, you see this technique, I'm doing it from the top to bottom. It's okay. It's fine if you start from the sternum, from the point of the sternum, and you go upwards, like I've showed you in the beginning. And then you do these openings. But you can also start from the breast, from the chest, and do the palpebral all the way to the sternum. Okay, as I was saying before, I don't think it's right to set a rule here, whether you start from the sternum or whether you move from top to bottom or from bottom to top, because the result is there anyway, and it's immediate, and it will occur regardless of whether you work from top to bottom or from bottom to the top. You be the judge, depending on the person that you're working on and how they also tolerate pain. You may come across people who will be more painful if you do it in one way or in one sense or in another, in one direction or in another. Loosening of the diaphragm. Okay, now we have to loosen the diaphragm muscle that, as you can see from this picture, is like an X-ray picture, is situated exactly underneath the stomach, above the stomach and underneath the lungs. So this muscle suppresses and elevates the rib cage so that it allows the air to come in and out. Now, what we have to do is to alleviate this muscle with a specific technique, because if it tenses up too much, it will compress the lung zone, and consequently that person will feel a lack of oxygen, or simply they will have a sensation of bearing a load on their chest. So, let's start. Now, you see, I will coast along the ribs on the diaphragm zone. And I use this palpé roulé technique that I've already shown you in the metameric massage course. It's very simple. You have to pinch the skin. Now I'm doing it with one hand, but you can also use two hands, depending on how you feel more comfortable. And then you pull the skin away from the entire zone of the rib, of the left ribs. And then you do the same exact thing on the right ribs. This way, you will alleviate in reflexology the entire diaphragm zone. Believe me, this alone, these techniques alone, have great results on the diaphragm and alleviate also this feeling of anxiety. But because I am very meticulous and accurate and so on, I want you to make the best out of this course, and so I first ask them to breathe in. As soon as the person breathes out, you apply pressure under the ribs, and then you open. I'm going to show it to you. I'm going to show it again. So you ask them to breathe in. When they breathe out, you press, you apply pressure, and then subsequently you open up a little bit. You do it 2 or 3 times. Breathe in, breathe out, press, and open. This is like I'm stretching the diaphragm here. Now we're going to do it on the right side, but careful because the liver is situated here. So when you put pressure with your thumb, it'll burn a little bit. So don't overdo it. So breathe in. As soon as they breathe out, not before, careful, with your thumbs, you do this stretching. I've only done it twice on the right, so as not to overdo it. Now, you can also do it with 2 thumbs. And you coast along the rib cage. You can always do this. In fact, I always do this, regardless of whether the person suffers from anxiety or not. See, when they breathe out, you coast along the ribs immediately underneath, and you stretch the diaphragm. Careful not to press when the person is breathing in. So don't apply too much pressure. Press only while they're breathing out. Discharge of the nervous system. Okay, now we were going to do the palpé roulé all along the spinal cord, from top to bottom. So we pinch the skin, as I taught you in the metameric massage, and you start this palpé roulé with 2 hands, slowly. Don't worry, where the skin doesn't pull away from the underlying tissue, don't insist, because in the beginning this is going to be more painful. So, you carry this roll of skin that it forms between your fingers slowly all the way down. You can see here in this area I'm having difficulty in pulling it away from the underlying tissue. So I do it slowly all the way down. This causes a strong discharge, especially when you do it from top to bottom of the nervous system. Then you also do it on both sides. So you pinch the skin and you carry the roll of skin outwards. Here the direction is important. You always have to work in an outward movement. Now I'm working on the right side of the customer. Subsequently, I will work on her left side. You work on this for 5 or 10 minutes. Consider that if you do the work that I taught you on the breast, you alleviate the diaphragm and you alleviate the entire spinal cord zone. and then I will show you how to massage this in reflexology on the feet. Then you know that you will have done an excellent job. Now we'll work on the left side of the customer. So you take the tissue and I roll it from the center outwards. This alone, this palpé-roulé work that I'm doing, alleviates the tension in the nerves that supply the breast. So you pull the skin away from the underlying tissue, and then you work in an outward movement. You work first on the top part, which is the oxygenation zone. Reflex zone in the foot of the diaphragm and of the solar plexus. Perfect. Okay, now we're going to draw the reflex zone on the foot of the solar plexus, which is situated between the big toe and the third toe. Here I have, these are videos that are part of the reflexology course. I have highlighted the zone, and there, underneath, we have a nerve connection to the solar plexus, and now I'll show you how to work on it. So, you see I'm highlighting it here, and then I stimulate it with my thumb. I hold the foot tight so that it doesn't slip away, and then I try to loosen. Now, this is normal speed, the video. But often, especially when a person comes for the first time, approaches the world of reflexology for the first time, the results are not immediate. It's almost like a bombardment of inputs that you're doing here. So there are two techniques, as I explained in the basic reflexology course, which are this one that you're watching now, and the other one where I was working at a faster pace. The important here is to loosen the zone. Once you have worked on the solar plexus, then we have to identify the reference with the diaphragm in the foot. So to find the diaphragm, we have to first highlight the articulation in the toes. And that's easy. See, if you pull the toes back like I'm doing now, the articulation is more exposed, is more visible, and then I draw a dotted line on top of it. Subsequently, immediately underneath that dotted line, well, that is the diaphragm zone, and this drawing almost looks like a swallow. Exactly. You see, I have highlighted it, and now I work on it. I apply pressure first on the side, and then I move all the way to the other side. This is a very quick technique, which will come with time, slowly. So you work the diaphragm zone, both with this technique and with this other technique, which, as you can see, is easier. You just press all the underlying nerves slowly. Now I'm showing you these videos, and I'm fast-forwarding these videos because it's a first level course, but this work that I'm doing on the foot supports everything, and I'm showing you the pictures, everything that I've taught you on the trunk. When you work on the foot, this will just extend the effects, because you will be able to work on certain nerves that you wouldn't be able to stimulate otherwise. So when a person comes to you for treatment and they suffer from anxiety, work on their chest, do the palpé-roulé, stretch the diaphragm like I showed you before. After that, you ask them to lie on their stomach, and you do a palpé-roulé on their spinal cord, and also working in an outward movement. This alone will allow you to achieve excellent results. Now, if the breast is too painful, then work on the back first, so that automatically the chest zone will start to loosen up. And then when after you've done all this work that you're seeing here on the back, the chest will be more relaxed and it will be less painful. An important thing is that if someone comes to you who suffers from anxiety and they're under drug therapy, don't ever dream of telling them to suspend the drug therapy. Don't worry, I will do the massage. You don't need the drugs anymore. This is up to the physician to judge, depending on how the person at the which stage that person is, to decide whether or not to suspend the therapy. Because if they do suspend the therapy and then they feel ill, well, they're going to come after you. So consequently, don't take that risk. Unless, again, you're a physician. That needed to be said as a mark of correctness and of professionality, because I think that I need to teach you to the best of my knowledge how to be professional. So go on with your work, don't worry, but be careful, don't take initiatives like this, so that you maintain the highest level of professionality.